There are reported 136.3 million emergency room visits each year, but only 16.2 million result in hospital admission. These numbers represent a need for better direction of care, specifically for emergency services. Telephone triage is a system that can offer this direction, and just a phone call away. This presentation will highlight this technology, some specific uses, benefits, limitations, and future potential innovations that will further increase the quality of care while reducing total health expenditures. Telephone triage systems are designed to provide a means for patients to communicate with healthcare providers for the purposes of assessing their needs for urgent care, administering medical advice over the phone, and as an assessment of patient disposition with the intention of directing them to the next step for treatment in regards to time, practitioner, and level of evaluation. In 2001, these systems were already used extensively, accounting for 100 million patients that assessed medical advice through telephone triage. This number has grown markedly to meet the needs of the Affordable Care Act, which has enrolled millions of additional Americans. Presently, emergency departments across the country are overutilized and in general misused for medical treatments that would be better attended to through other modes of care. Consequently, emergency departments experience high wait times and many patients leave without being seen. Telephone triage creates an opportunity to assess cases and better direct those that are low acuity. Telephone triage systems can reroute some of those patients into appropriate care settings and reduce overall costs while providing a level of care. These systems can potentially play an important role in reducing costs for underrepresented populations, the elderly, and those that are uninsured.
In a study with the Optum Nurse Line, a 24-hour telephone service that provides coaching and personalized support from nurses, researchers monitored the calls of patients and the recommendations of the nurses. 57% of the patients were compliant regarding their nurses' recommendations. On a 30-day average, they found that the care expenditures were $328 lower among compliant callers than non-compliant callers. Some of these savings were attributed to the nurse's advice of seeking lower level and therefore less expensive level of care. It can be noted that having a telephone triage system may hold some economic benefits.
Care coordination is identified by the Affordable Care Act as a key strategy for improving the quality and cost-effectiveness of healthcare. The definition of care coordination is the deliberate organization of patient care activities between two or more participants, including the patient, involved in a patient's care to facilitate an appropriate delivery of healthcare services. Organizing care involves the marshaling of personnel and other resources needed to carry out all required patient care activities and is often managed by the exchange of information among participants responsible for different aspects of care. Care coordinators must be highly trained professionals who are knowledgeable and proficient at many different aspects of healthcare. For this reason, nurses have taken a central role in care coordination. Telephone triage is a systematic process by which healthcare providers, often a nurse, assess a patient over the phone, screen their symptoms for urgency, and advise them where to go seek medical attention. Telephone triage has been used in cancer care as a way to monitor patients who may not have adequate support or require frequent close monitoring of symptoms and side effects of cancer and treatment. Telephone triage has grown in importance, particularly as the treatment and supportive care of cancer patients moves from inpatient to outpatient ambulatory setting. Overall, telephone triage better coordinates the cancer care and improves patient experiences and outcome. Medicaid and uninsured patients are more likely than insured patients to utilize emergency departments for low acuity health problems, contributing to the overcrowded emergency rooms, emergency care delays, and increased healthcare costs. Telephone triage service is used in many countries to help guide healthcare decisions over a telephone. In this study, ED utilization by uninsured and Medicaid patients after availability of telephone triage, it examined the relationship between telephone triage and emergency room visits pre- and post-telephone triage. The telephone triage was implemented to assist patients with minor healthcare problems that did not require an emergency room visit. The year after telephone triages were implemented, they saw an increase in ER visits overall. However, the study did find that the visit volume decreased in emergency room department for Medicaid and uninsured patients with low acuity healthcare problems. Overall, the triage system was helpful in patients determining their acuity level and where to best seek treatments. The chart on the slide shows the percentage of where patients who use the telephone triage were advised to go. 44% were advised with self-care options, and only 19% were advised to actually go to the emergency room. Overall, the telephone triage that was implemented at this hospital allowed for less crowding in the emergency room.
Asthma is a leading cause of childhood hospitalization, disability, and healthcare-related costs. Pediatric asthma care in the United States is fractured, with patients too often seeking non-urgent care in the emergency department. Asthma disproportionately affects Black and Hispanic children, and these populations have been shown to be more likely to use the emergency department as a routine source of care. In addition, prior research suggests that many families traveling to the emergency department for non-urgent complaints are simply looking for reassurance, contributing to the problem of emergency department overuse. Telephone triage systems used in practice for an estimated 39 million calls per year may conservatively over-refer children to the emergency department. The use of video to enhance triage may help address these concerns. The nurse or physician providing triage may be able to determine a child's level of distress more accurately through the use of video paired with verbal questions. In addition, families may be more effectively reassured if a clinician has seen their child. Researchers from the University of Colorado assessed the feasibility, acceptability, and utility of videos sent via mobile phones to enhance pediatric telephone triage for an underserved population with asthma. They found that among 60 families, 80% of parents reported that sending a video would be helpful, and 68% reported that a nurse's review of the video would increase their trust in the triage assessment. 75% of the families successfully transmitted a video to the research team. All clinicians found the video reassuring regarding the severity of the child's asthma exacerbation for 68% of children.
According to a study in Denver, Colorado, 2/3 of the primary care offices use an answering service, and 93% of them required the patient to self-assess their issue as an emergency or not. Due to this, 10% of the calls were not forwarded to the on-call physician. A panel of physicians later reviewed these calls and reported that in over half of those calls, they would have wanted to talk to the patient. More than 1/4 of these patients suffered ongoing pain and discomfort, and 8% required an emergency room visit. There is potential risk for harm or death if a patient were to call with a problem serious enough and not be able to assess himself or be assessed well enough.
So what are the next steps in the evolution of the clinical call center? The answer is found in the latest technology. Nurses are already very effective at the usage of triage protocols and their nursing judgment to take care of patients. However, the new technology resources available today have created an opportunity to improve the efficiency of nurse call centers and provide new features that will benefit providers, patients, and nurses. Here are some of the new features that should become standard in any call center software platform in the very near future. Doctors and triage nurses will be able to send secure text messages without using an app, which could comply with HIPAA requirements. Patients will also be able to request a nurse directly from their phones without speaking to an answering service. Triage notes from call centers have the capability of being sent directly back to the client's electronic medical record system, which will increase the continuity of care. The rapid evolution of technology is helping nurse triage call centers provide improved service to both providers and patients. Patients will more easily access nurse triage at the touch of a button on their smartphone, and they'll be able to communicate securely with their provider via SMS. Nurses and physicians will count on having all the patient's information at their fingertips thanks to integrated EMRs and improved communication between distinct medical information systems. All of these enhancements are either happening now or will be implemented soon, and they will contribute to the ability of nurse triage systems to ensure that every patient gets directed to the right level of care at just the right time.